Hello everyone, in this video we will summarize the blood supply of the esophagus. Before we start, I'll ask you to subscribe to the channel and let's start. The esophagus is divided into three parts. Each part has its own blood supply: cervical esophagus, thoracic esophagus, and abdominal esophagus. Cervical esophagus supplied by the inferior thyroid artery, which is a branch of the thyrocervical trunk. Thoracic esophagus supplied by the bronchial artery, esophageal artery, and the vascular chain of the branches of the descending aorta. About the vascular chain, they are formed by 5 branches of the aorta, anastomosed superiorly with the inferior thyroid artery, which, as we said, supply the superior part of the esophagus, and the inferiorly with left phrenic and left gastric arteries, which supply the lower abdominal esophagus, and this will form a vascular chain on the esophagus itself. Abdominal esophagus supplied by the left gastric artery and left phrenic artery. So cervical esophagus supplied by inferior thyroid artery, thoracic esophagus supplied by the bronchial artery, esophageal artery, and vascular chain. Abdominal esophagus supplied by left gastric and left phrenic arteries. So this dense blood supply of the anastomotic nature of the esophageal blood supply, it renders this organ, the esophagus, virtually immune to infection. But if injury occurred here, the result is a life-threatening hemorrhage. Have a nice day. Thank you for watching.